folks, Denny at TheraThink here, and today I want to talk about optimizing your mental health insurance income in an ethical way. TheraThink, we do mental health insurance billing and help private practice practitioners to both increase their rates, get paid more per session, and manage all of the billing process. I'm going to keep this pretty high level and short. The 80/20, the sort of like highest level things you can do would be to make sure that you're using the intake code 90791 for your first session with clients. We see a lot of folks not do that. Make sure that you're conducting services that are 54 minutes or longer in length so that you can use 90837 for billing. And you can always verify eligibility and benefits and ask a representative about the client's plan to confirm that these codes are eligible to be used. They are routine outpatient mental health psychotherapy codes, and almost always they are now eligible. Previously, years back at this point, many times 90837 was denied. This has changed in the industry, and but there's a lot of legacy information about that. So we're trying to help combat that. You can, of course, renegotiate your rates with insurance companies, and you can also finally bias clients from your best paying plans, insurance companies, insurance contracts, and subcontracted plans within them. Let's talk about coding. Again, you're going to want to make sure you use the intake session and intake code, diagnostic evaluation, and a 54-minute plus psychotherapy code. Two add-on codes that you can consider using, depending on when you're providing services, would be add-on code 99050, which is describing services provided in the office outside of regularly scheduled hours. So this might be when you're working with a client and you make an accommodation outside of your typical hours to be able to work with them. You can use add-on code 99051 when you're providing services during a weekend, an evening, or on holidays. Now, these codes might not be reimbursed. They might be denied because they might be considered non-routine outpatient mental health therapy codes. But you should bill them if it is the case, because coding is important to be doing as accurately as you possibly can. So please do make sure you're using these add-on codes to best describe the services being rendered based on the services that you are indeed providing. Rate negotiation. We have a rate negotiation tool at TheraThink. You can go to therathink.com/rate-negotiation-tool to check that out. It helps you generate a template that you can then use to send off to a respective insurance company to negotiate your rate. In that template, we do mention things like inflation and macroeconomic data. It's a good idea to mention that. Certainly that's a reasonable argument for why your rates need to be increased. It's because things just simply cost more. And if you have not seen an increase in your pay relative to the increase in costs as a result of inflation, as measured by the CPI from the government, which again is what we reference in our rate negotiation tool, you would want to make sure to mention that. You also, if you are providing availability in early morning sessions, in the evenings, weekends, on holidays, etc., you should mention that as well. One, it's important to do so that your clients know that you're working on those hours potentially, but also it's important to let the insurance companies know. They want to have providers working with them who can facilitate times that fill in the coverage gap for the insurance company's clients, your clients in this case, as well. And by providing that availability, you are doing the insurance company a service by increasing their service availability as well. So you should ask for a compensation accordingly. If you speak multiple languages and you haven't yet mentioned that in your credentialing, you should definitely mention that. It's an important thing for insurance companies to have And I've worked with providers who have had insurance companies reach out to them to directly ask if they will work with a specific client because of their language. So you should definitely make sure to mention that. That's a highly desirable uh, attribute thing you can provide to your clients and as a result provide to insurance companies. If you are conducting different modalities of treatment that are uh, important to clients as well, you want to make sure to mention those. If you have specializations of some sort, make sure to mention that. Likewise, if you have any accreditation or continued education that you have um, gained, you'll want to make sure to mention that in your rate negotiation letter as well. When asking for your rates to be negotiated, I would recommend 7 to 15% in terms of the increase. And you're going to want to quote that rate in an actual mathematical formula for the inside of your rate negotiation letter. Make it easy for the person reading your letter to say yes by providing them your existing rates, the ask of the 15% increase, and then the new rate amount. Finally, I would encourage you to ask annually. There's no harm in doing so. In the same way that inflation goes up annually, your rate should be going up annually as well. It's totally reasonable to be reaching out to insurance companies to ask them to honor increases in your rates to compensate you for increases in inflation and costs of goods. In terms of optimizing for insurance plans via your clients that you take on, for new clients specifically, it's really a good idea to be working with as many insurance panels as you possibly can. The more variety that you work with, the more variety of rates that you have inbound to choose from. And as a result, as well, you're able to better negotiate your rates with insurance companies by stating that I do indeed get paid this much at this insurance company. I'm not asking for that exact amount because I know you can't. That's a 30% increase, but I'd like a 15% increase in my fees to make sure that I'm still able to work with your clientele without having to stop working with them. Of course, when actually choosing new clients to work with, you're going to want to bias higher paying insurance companies and potentially higher paying insurance plans to figure out what plan that the client has within their insurance brand. You'll want to ask about that during eligibility and benefits verification. If you are not doing eligibility and benefits verification, meaning calling up the insurance company, getting a reference ID, rep's name, date that you called, and understanding the quote for all of the benefits, co-payment, deductible, co-insurance, authorizations if they're required, if they have EAP claims, EAP benefits, excuse me, and of course making sure that you understand their plan and your network status within that plan. I would strongly recommend doing so. We do that at TheraThink for free as part of our billing service because it's so important to make sure that the clients that you want to work with can work with you, that they have active coverage. There's nothing amiss, that you understand exactly how much they're going to owe you per date of service at the outset. And of course, you can also bias easier to work with companies for insurance billing or hire a billing service to manage that for you. So for folks who have a hard time getting paid by the highest paying insurance brands that they work with, it could be a good idea to work with a billing service to manage the time intensity that's involved in billing so that you can continue to work with a higher paying insurance plan. Now, again, if all of the insurance billing side of increasing your fees and getting a sense of when to use this add-on code or that add-on code, coding, increasing your rates, etc., or solving any problem claims that might come across your plate. Well, that sounds like a nightmare. Well, it can be. I don't know if there's a better answer than that. It can just be, it is just time intensive. It's time intensive for us at TheraThink. We do mental health insurance billing, and it certainly takes us quite a bit of time to make these phone calls and verify eligibility and benefits, to submit the rate negotiation letters, credentialing, etc. It is time intensive. So you could consider hiring a billing service like TheraThink to save you some time and energy so you can either focus on adding new clients expanding your practice, working with more clients, working with the same clients more often, or just taking a break. Frankly, there's nothing wrong with enjoying yourself and having a bit less on your plate, especially when it comes to waiting on hold with insurance companies. So I'd be happy to help. If you do want to reach out to us at TheraThink about billing, feel free to send me an email. My name is Denny, Denny, at therathink.com, THERATHINK.com. That's my email. You can send me an email and we can set up a time to chat, or you can just explain your billing needs and what you're looking for. I'd be happy to go back and forth a little bit and see if we're going to be a good fit for you. You can also schedule a phone call with us directly at therathink.com/schedule. That's THERATHINK.com/schedule. Again, just to discuss your billing needs. Thanks so much for watching. Take care.